Welcome back everyone. Today I'm going to show you some rehab exercises for meniscus tears or meniscus injuries. A lot of times these tears can occur from aggressively stopping and twisting and rotating your knee, normally seen in netball, football or basketball. If you do have a knee injury, it tends to swell up or get stiff, or you might hear some popping noises, or it gets stuck in a position unable to lock out. If you do have these symptoms, please see a health professional first before trying these exercises. Now, these exercises that I'll be showing you can reduce some pain or prevent a lot of the injuries in the future by strengthening up the knee. Some people have even reported that these exercises has helped them opt out of surgery, so not needing surgery as well. So I hope these exercises helped you as much as they helped me and my patients. Tests for meniscus tears. To help you confirm it is a meniscus tear or ligamentous strain on the knee, I recommend placing your knee in a slightly bent position and rub your thumb over the knee joint line in a firm and controlled manner. Try to feel for any warmth or swelling, unusual alignment compared to the other knee, or knee pain. Just take your time to investigate. High pivoting and agility sports put a lot of stress and strain on these knee structures. If there is no pain, try moving your knee straight and then into a bent position again back and forth. Then try to move in a more circular movement left to right. If your knee locks and it does not allow you to straighten again, or if there's any pain, you may have a tear or something causing a wedge in the knee joint. If you have any of these issues, there's a high chance you have an injury. I recommend you see a health professional before trying videos or exercises on the internet. Hip adduction. Lay on your side with your top leg slightly behind you to give you some balance and your arms supporting your neck. Now raise your leg with your knee extended and then back down. By being in a stable position, you can concentrate on working on the right muscles. Do about 10 to 20 raises on both sides, 3 to 4 sets. If you find this exercise too easy or too light, just place an ankle weight onto yourself. I'll leave a link in the description box below on where to get them, but please be careful, as this can add a lot of stress on your knee. So start doing the exercises without the weights first. This exercise works on the main hip adductors, which brings your hip inwards, such as the adductor magnus. These muscles are very important to stabilize the hip and the pubic bone. Sometimes when you have an imbalance with these muscles, it can cause issues in your knee and the pubic symphysis. Some athletes even develop arthritis in the groin. Hip abduction. Lay on your side with your bottom leg bent to give you more balance and the upper leg straight. Now raise your leg up and down in a controlled manner. Do 10 to 20 raises on both sides, 3 to 4 sets. You can support your head with the other hand that's on the bottom, and with the other hand you can add some stability by placing it on the floor. This will allow you to activate the right muscles and instead of worrying about falling over. This exercise will work on the glute medius and minimus muscles, which is the muscles that are on the side of your hip. This muscle plays a major role in knee stability, walking and running efficiency. If you find this exercise too easy or light, you can place an ankle weight onto yourself. Once again, please be careful, as this can add a lot of stress on your knee, so start with doing the exercises without the weights first. Hip muscles play a big role in the knee stability and foot placement. As you can see, when I squeeze the inner thigh muscles together, aka the hip adductors, my knees get pulled in. This adds a lot of pressure on the inner knee ligaments and the outer knee meniscus. It also rolls my foot inwards. So by having overly strong, tight hip adductors, it can cause foot pain and knee pain, which may even increase the possibilities of injuries in the future or poor running technique. This can be avoided by having proper strength in your hip abductors, which pulls the knee slightly outwards, preventing knocked knees. But if your knees are pulled out too much, it can cause some stress on the outer knee ligaments and the inner knee meniscus. Therefore, we need to have a well-balanced tug-of-war between the inner and outer hip muscles. In most people, we tend to have weaker outer hip muscles. So if you're unsure, just work on your outer hip muscles, which is hip abduction. Hamstring heel digs. Lay on your back, bend your knees, and dig your heels into the floor. Then slightly pull your heels towards your bum, just enough so your heel's almost sliding towards yourself and your bum is almost off the floor. Hold this isometric contraction for 20 to 30 seconds. Have a rest for about a minute and then repeat the exercise again 3 to 4 times. This will contract the muscle behind the thighs, which is the hamstrings. The hamstrings cross the knee joint and is crucial for knee flexion, running and walking. Towel slides. Training the hamstrings at home may be quite challenging. We need to get quite creative, especially if fancy equipment is expensive. To work on the hamstrings, get a towel and lay it on a smooth surface where the towel can slide easily. Dig your heels into it and your back flat against the floor. Now slide the towel away to a point where you can still pull it back towards your bum. Press your heels onto the floor to the point where your back is almost lifting off the floor, and then perform the sliding movement. Do about 8 to 15 repetitions for 3 to 4 sets. I found this exercise extremely difficult and my hamstrings were burning afterwards. So I highly recommend doing the exercise only if you're fully recovered from your injury and you just want to strengthen your hamstrings. Hamstring curls. Have a rolled up towel and place it just above your knee, whilst laying on your stomach on the floor. By having your knee elevated on the towel, it will protect the knee you're trying to rehab from unnecessary rubbing on the floor. Whilst supporting yourself with your elbows and your other leg touching the floor, raise the back of your heel towards your bum, and then back down again slowly. Do 10 to 20 repetitions, and do this on both sides 3 to 4 sets. If you find this exercise too easy, you can add ankle weights to your leg. I want you to consciously squeeze and activate the muscles in the back of your thigh, the hamstring muscle on each movement. Remember, you are the boss here, and you are in control. In 2015, a Journal of Physical Therapy Rehabilitation published a paper on the effect of exercise therapy compared to arthroscopic surgery on middle-aged patients with degenerative meniscus tears. After the 12-week exercise program, there was significant improvement in isokinetic quadricep strength immediately after the program, compared to treatment with surgery. Step-ups. You can do this exercise at home on some stairs or a stack of phone books pressed up against the wall so they don't move. Here I am using a humble footstool. Simply step on one foot at a time, then back down again in a controlled manner. Please concentrate on the 2 phases of the movement, up and down. Do this for 10 repetitions and repeat it on both sides 3 to 4 sets. On the up phase, the muscles around the knee contracts, especially the quadriceps. We want to work more on the VMO muscles here because it's very important for knee strength and patella tracking. As you step down, I want you to do this slowly as possible to allow eccentric contraction. This is a phase where the muscle is lengthening under load. This will strengthen your muscles for forces that lengthens it, which will prevent you from injuries in the future. Side step-ups. Get yourself a stool. The lower the step, the easier it is. The higher the step, the harder it is. Now step on the stool and then back down again in a slow and controlled manner. Do 10 repetitions and repeat it on both sides 3 to 4 sets. This exercise will mainly work on the quadricep muscles, but this variation in particular will give you some strength, confidence, and control again on moving side to side. It will also slightly work on the inner thigh muscles and the outer hip muscles, such as the glute medius and the glute minimus. Once again guys, thanks for watching. I really want you to join my VIP Facebook group. I want to build a community there where you can ask questions and I'll do my best to answer them. There'll be other health professionals in that group as well to help you out. I'll put a link in the description box below. Now, if you do have pain in the knee or pain in the hip, I highly recommend you check out my SIJ joint video. That video will help strengthen the necessary muscles to prevent pain and reduce pain that you're experiencing. Now, if you do have pain in the knee, into the shin, and into your ankle or your foot, I highly recommend you check out my shin splints exercise video. That video will definitely strengthen up the necessary muscles to prevent you from any pain or even improve you with your walking and running and other sports as well. Remember to support my channel, hit subscribe, hit like, comment below if you have any questions, and I'll see you guys in the next one.